Hello, my name is Aaron Unger, and this is an oral history interview for the Transgender Medicine Oral History Project. Could you please state and spell your name?
Okay.
What's your name?
My name is Richard. And I stay in Florida.
Oh, wow, I'm from Alabama. That's cool. What are your, or what is your gender?
Um, I'm a trans I'm a trans female. No, I was originally a cis man, but I've transitioned to a female.
Awesome. Um, how old were you when you came out as trans?
Um, I was 21 years old when I finally decided to come out as a transgender.
Nice. What gender affirming care have you experienced?
Um, I've um I've gone through hormone replacement therapy, you know. Yeah, that's um what I've gone through. That's yeah.
Awesome. What type of clinic did you go to for your hormones?
So we went to a private facility to get this done. I wasn't supported by my parents, but me and some other trans friend of mine at this place. I can't remember, I can't recall. I think it was in Texas. We yeah. So it's a private facility that we had to go for this procedure.
Did you used to live in Texas?
Um, I I visited Texas, but my last time going to Texas was basically for this procedure for me to get my immunotherapy. Yeah.
Awesome. So why did you go to Texas and not Florida?
So basically it was more of my friend got their procedure done in Texas, and and I I believe they they recommended the private facility, so I just followed through. It's not like I made any research here in Florida, but I just want to really get this therapy replacement surgery. So we just had to go to Texas and we had to get this done.
Awesome. Um, Tell me about a positive experience with your medicine, like with the clinic.
So the positive experience I had was um the 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 people there, they were welcoming. They made me feel comfortable enough. And I was I wasn't segregated. I wasn't looked down on, or it was really as if I I was part of them. I was counted as human there at the facility. Um, yeah.
Awesome. Have you had any negative experiences?
I've had negative experience. Trying to get care. Yeah, in Florida, I've been to um, I've been to some medical facility, and when I get there and I try to tell the doctor I would like to talk to a female specialist, and they always give me some kind of weird replies like, okay, no, we can't get you that, it's not available, we can do this. They try as much as possible to make me feel uncomfortable seeking medical care in the facility, maybe because of the way I appear, or maybe the way I talk or act with it's kind of really disturbing, but it's what we face here in Florida.
Um, how has your life changed since you've transitioned?
Well, um, since I transitioned, it's I've really learned to stand for myself. Life has really been kind of tough and difficult, trying to face up people, trying to pull you down in the streets, people mocking you, and trying to just laugh at you when you walk. The way I dress, I put on skirts, like mini skirt, and people always, the way they always look at me, and they be like, "Oh, you're a man, you're still a guy," and based on me being an African American, that's even worse because they always tell me, go back to where you come from, you're not part of us. With all this, I really feel depressed. But I try as much as possible to be strong for myself. And I'm trying to just to just be there for myself.
Mhm, definitely. Um, so you came out when you were 20. When did you start medically transitioning?
Um, I think a year after, when I was 22.
Nice. Um, and then do you have insurance?
The I was only insured through my parents workplace. I think they provide them some kind of private insurance, so that's the I'm kind of covered because I'm like the only offspring. I'm the only child. So it seems I'm kind of covered. But I really use their insurance if I'm supposed um to go to any medical facility. Most times I just want to just pay out of pocket for anything I get, because I feel I just want to be left alone. I don't want to be associated with what they have, because they basically they don't support what I'm doing. But so I'm covered, but I don't really use this insurance.
Mhm, that makes sense. Um, have you ever been misgendered or dead named at your clinic?
Yes, I've been misgendered when I sometimes when I go to the clinic, they've called me Mr., which is kind of offensive because to me I'm not masculine, I'm feminine, and yeah, this is who I am now. I feel safer being a lady, you know, but most times people still look at me and call me a man, and it really pisses me off. But apart from that, I've gone to medical places and they use a male oriented pronoun for me, and yeah, you know, when they examine when they examine, they touch me inappropriately, and yeah, it's kind of it's really sad and disgusting, but yeah.
Hmm. Um, this is going back to more the beginning of your story, but how did you know you were trans?
Now, I started feeling I started developing more closeness or more fond of a feminine nature. I started associating more with a gen or with the feminine gender. I started wearing feminine clothes. You know, I view things. I want to I really wanted to be part of the feminine culture because it's to me it was safer being a feminine gender. I really love the way they act, and it's kind of aligned with what I wanted for myself, and I I felt okay that I would want to really transition being a feminine gender.
Um, could you explain what you mean by you feel safer as the feminine gender?
No, in the society, I feel most times priorities are given to we, the ladies. You know, we kind of we kind of we are the one that people really want to be with us. You know, people strive to get closer to us. They do things to catch our attention, and with this, you know, you get many people trying to many suitors trying to come close to you, you know, people always wanting to be around you. You know, with these people trying to be around me most times, I feel there is always some sort of protection. I might always call on if I need any.
Awesome. Um, do you have a favorite queer related story?
Um, I don't have any I can think of at the moment.
That's fine. If something comes up, feel free to share it.
Oh,
Uh,
definitely.
have you had any challenges with like getting medicine or
Um,
just any in general with medicine?
the challenge I have getting medicine is I'd say it's more of trying to see like a specialist or a practitioner, and me not being able to do that because the people at the medical facility feels I'm a male, which is kind of well, sad. I feel when I try as much as to explain the condition or what I'm kind of what I'm going to a female, they understand me better. I might go to a male medical doctor and tell him oh, I'm having stomach pains. I feel unwell in my stomach. They might just brush it off and tell me, just need to go home and have a little bit of rest. But if I'm supposed to see probably a female medical professional, they might just tell me, okay, maybe it's just maybe it's kind of related to, you might be having cramps or something. So they kind of make me feel comfortable when I talk to them. I feel comfortable because I believe these kind of things from my perspective, and they are judgmental. So I really don't want to just get associated with the male medical professionals.
So, do you feel that your doctor understands trans bodies?
I really don't frequent clinics that often, but I strongly feel the facility that I use, the medical practitioner there, the male medical practitioner there, they really don't understand the kind of care I need. They don't understand what I'm trying to say. They kind of misjudge um my symptoms or things I tell them about my conditions. If I go there and I'm trying to tell them, okay, I'm having some kind of swelling around my chest area, and I don't know, it started suddenly. They don't know what they might say, probably because they don't understand how trans trans medicine works. So it's kind of sad and difficult to try to explain to them.
Um, and then have you ever considered like halting your transition like medically because of like difficulties?
No, I haven't considered that. I wouldn't want to do that. I'd still want to continue with with my with my trans gender, continue with this role. I have already choose this path, and this is something that I wanted, and I'm probably make sure that I'm gonna see through this, no matter how difficult it might seems, but it's something that I'm committed doing. I don't care how long or what people say. I will keep on pushing for this.
Yes. And then what is your involvement with the queer community?
Um, Typically, I'm more of an introvert. I really I really don't go out, but definitely, if there are things I share flyers. I'm part of. I am basically in most Reddit groups that talks about this our community, but I don't physically attend any of these I don't physically attend any of these events, but always sharing online to support the community.
Awesome. Okay. Those were all my questions. I'm sorry it's only 25 minutes, but is there anything else that you'd like to add?
Um, I don't know if there are kind of legislation or there are kind of talks evolving about most medical facility being kind of open to the trans community. It's gonna really go a long way to make people like me feel comfortable, because I still feel there are much more people out there like me that are that are skeptical about coming out as trans, because the way they feel, the way they see trans, the way most medical facility, the way they treat trans people, it's kind of sad and appalling. But I would like to know if there are programs coming out that will definitely support the trans community rights. It's gonna be a long way. Or if there are other place um or other groups we could join to make our voice heard. um it's If you could share, I don't know, it would really help.
Definitely. Yeah. I don't know any off the top of my head, but if I do, I'll keep you updated. But thank you so much for your time today. And yeah, um, have a great night.
Okay, Ian, thank you also. Bye.